Hello, my name is Christopher Jamie, and today I will be performing I'm going to be demonstrating a subcutaneous injection. Here's my badge. These are my supplies. My supplies are going to be clean set of gloves, my syringe, my medication vial, my gauze, and my alcohol swabs. Okay? So, to start off this video, I'm going to go ahead and verify the healthcare provider's orders, and I'm gonna go ahead and verify. I'm gonna be verifying the 6 rights of medication administration. So the first one is going to be right patient, right drug, right dose, right time, right route, and lastly, right documentation. Once I finish verifying all 6 rights of medication administration, I will go ahead and verify the order in the EHR and check the MAR. Okay? The doctor has ordered 1,000 units of heparin. It is supplied as 10,000 units in 10 milliliters. So, after calculation, the dose will be 1 milliliter, which equals to 1,000 units. Okay? Once I go ahead and verify that, so the correct dose overall is going to be 1 milliliter. And that is what I will be drawing up today. Okay? So once I'm done with that, I will go ahead and gather my supplies and enter my patient's room. I will close the door behind me to ensure patient privacy. Once I'm in there, I'm going to set my supplies on a clean flat surface, and I will go ahead and introduce myself to my patient. First I'm going to go ahead and hand hygiene, and then introduce myself to my patient. Hello, my name is Christopher, and I will be your nurse for today. Okay, once I've introduced myself, I'm going to ask for information to verify. Okay, may I have your first, last name, and date of birth, please? Okay, he's going to show me the wristband. I'm going to verify this, and this is going to be my second check towards the medication, just to make sure. Okay, Mr. John, do you have any known allergies towards like food, medication, or environmental allergies? No? Okay. So my patient states that there are no allergies present. Alright. Thank you, Mr. John. So today, your doctor has ordered heparin, a heparin injection. Sorry. So a little information about heparin. Heparin is an anticoagulant, also known as a blood thinner. Okay. It prevents the new blood cells from forming and keeps existing clots from getting bigger. Okay. So the way heparin works, right? It's by reducing your blood's ability to clot, which is thinning, which is why they call it blood thinner. Okay? Alrighty, so it's commonly used for DVT, which is deep vein thrombosis. Okay? So, some of the common side effects that you should be aware of. It's mild pain, bruising at the injection site. Okay? Some adverse effects that you should be aware of include severe headache, dizziness, shortness of breath, or blood in urine, or stool, for that matter. Okay? Please notify us if you experience any of these adverse effects, as it is crucial for us to tackle them head on first. Okay, you might feel a slight burning and stinging sensation during the injection, which is normal. Now I will allow the patient to ask any questions. Okay? I will prepare the medication. I will prepare the medication now and verify it for the 3rd time. Okay? There's going to be the 3rd time that I verify the medication that it goes to the right patient. I'm going to go ahead and perform hand hygiene and apply my clean gloves. Gloves are on. I will start by cleaning the top of the vial with an alcohol swab. I'm going to go ahead and discard my trash. Clean the top. Now that I'm cleaning the top, I'm just going to go ahead and dispose of my alcohol swab. Okay, now the syringe that I will be using is the same tuberculin syringe. I'm using the same one because I was limited on supplies. It's a 1 milliliter syringe, 25 gauge, 5/8 inch needle. Okay, so I will go ahead and remove it from the packaging, and I'm gonna go ahead and draw 1 milliliter of air. Like so. Just to verify, here's the syringe, 1 milliliter. Okay, once I've gone ahead and drawn 1 milliliter of air, I'm going to now insert the needle into the medication vial. Alrighty, and now I'm gonna go ahead and push the plunger and administer the air into the vial. Once that's done, I'm gonna go ahead and invert the vial and draw the same amount, 1 milliliter. If you find any bubbles, just go ahead and tap. Okay. Now, once that's done, I'm gonna go ahead and recap using the swoop method, like so. And I'm just gonna go ahead and secure that. And now, just to verify, I have 1 milliliter of heparin in the syringe, and I'm just gonna go ahead and place the syringe down on a clean flat surface. Now, to select the site, it's recommended, well, to inject heparin, the preferred site is the abdomen, at least 2 centimeters away from the umbilicus. Okay, so once I go ahead and verify the area, I'm going to go ahead and ask Mr. John if it's okay for me to assess. Mr. John, is it okay if I go ahead and inspect and touch around and feel around, palpate your abdomen? Yes? Okay, after that, I'm going to go ahead and pinch you slightly, okay? It's not going to hurt, okay? So now I'm going to go ahead and inspect the abdomen for bruising, redness, swelling, or lesions. And then I'm going to go ahead and palpate for tenderness or masses. So I'm going to go ahead and palpate. Okay. Once that's done, checks out. It's a good area to inject the heparin. Now I'm going to go ahead and check the skin fold thickness. So I'm going to go ahead and, for this purpose, just to demonstrate to the camera, I'm going to do it the opposite with dominant, non-dominant. So you want to go ahead and slightly pinch the skin, and you want to make sure that the skin fold is at least half the length of the needle, which in this case it is. Okay? Place that down on a clean flat surface. Mr. John, thank you for allowing me to assess your abdomen. Everything looks good, and we're now going to go ahead and proceed. Now I'm going to go ahead and clean the site with an alcohol swab. Right here, discarded my trash. Now I'm going to go ahead and start inward and work my way outward 2 inches. Like so. Discarded the alcohol swab. Okay, so I'm gonna let my area dry completely. I'm not gonna touch the area. Now I'm gonna go ahead and remove the cap from the needle. In the dart-like method, like holding it like a dart with my dominant hand this time, I'm gonna go ahead and place the palm, and then I'm gonna go ahead and pinch the skin like I did before. And now I'm gonna go ahead and inject the skin. Mr. John, I'm going to give the injection now, okay? Okay, so I'm gonna insert the needle quickly at a 40 to 5 degree angle. Now with my non-dominant hand, I'm gonna go ahead and stabilize the syringe, like so. Now with my with my dominant hand, I'm gonna go ahead and start pressing the plunger slowly. It should take over 30 seconds, so take my time. Okay, medication is fully administered. I will take a gauze and gently remove the syringe and apply the gauze, and I will I will put the safety cap on the syringe, drop into the sharps container. I don't have a container with me here, so I'm just gonna place far away. Okay, you don't want to massage the area where the gauze is. You're gonna lift to see if there's any bleeding. There's no bleeding present, and then I'm just gonna go ahead and discard that. My patient needs no bandage, so there's no bleeding. Okay, so once I do that, I'm gonna go ahead and ask the patient if they're okay. Mr. John, everything okay as I remove my gloves and perform hand hygiene? You're okay, Mr. John? Alrighty, perform hand hygiene. Okay, Mr. John. Well, I'm glad that went well. Do you happen to have any questions for me? No? I'm going to make sure my patient is comfortable and that Mr. John has his call light. I'm going to gather the rest of my supplies and I'm going to exit the patient's room and go ahead and document. Okay? Thank you for watching.